Hi, everyone, and welcome. Thanks for joining us for this deep dive.
Hello.
Today, we're getting into something really significant, and it's evolving right now. The assisted dying bill that's before Parliament.
It's certainly a topic that raises profound questions,
Yeah.
deeply ethical ones.
Absolutely. It touches on, very personal beliefs, and it's complex stuff for society to grapple with.
It really is. Requires a careful look at the legislation itself and all the different viewpoints.
Exactly. And to help us navigate this intricate landscape, we're really pleased to have Professor Mark Ellison with us.
Glad to be here.
Professor Ellison is a distinguished medical ethicist, a legal scholar, too, with over 25 years of experience in healthcare law and bioethics. So really brings a wealth of knowledge. Welcome.
Thank you. It's a vital conversation.
This deep dive is brought to you by the Westferry Times. And our aim today is pretty straightforward. We want to get to the heart of this bill, explore the arguments around it, and try to understand what it might mean for people and for us all, really.
That's good.
Okay, so let's dive right in. For those of us maybe just catching up, what exactly is this assisted dying bill proposing?
Right. So at its core, the bill, its official title is the Terminally Ill Adults End of Life Bill. It aims to change the law
How so?
to allow adults who are mentally competent and have a prognosis of less than 6 months left to live,
Okay.
the option to request medication from a doctor to end their life.
But with rules, I imagine, strict rules.
Oh, absolutely. Subject to a number of very specific, very carefully designed safeguards.
And I heard those safeguards have actually sort of evolved a bit as the bill's gone through Parliament.
Yes, that's right. That's a key point. Initially, the plan required approval from 2 doctors plus a high court judge.
Right, a judge. That sounds like quite a high bar.
It was intended for rigorous oversight, but then concerns came up that it might be too cumbersome, maybe even inaccessible for people who actually meet the criteria.
Okay, so what's the alternative then?
Well, an amendment was put forward to replace that judicial review step with a multidisciplinary panel instead.
A panel? What kind of panel?
It would bring together experts from different fields, healthcare, law, social care, to look at each case individually.
Ah, okay. So the idea is still to have that really thorough check,
Exactly.
but maybe make the process itself a bit more, manageable for the person involved.
Precisely. It's trying to find that very tricky balance. You need the scrutiny, the expert assessment of capacity and eligibility,
Mm-hmm.
but also streamline things, remove some of those big hurdles of full court review could present. It's a real focus.
And it's really worth stressing, like you said, this is specifically for terminally ill adults.
Yes,
How does that compare internationally? Because other places have laws like this, right?
that's a critical distinction, yes.
Hmm.
The UK bill, as it stands now, is actually quite narrow in who's eligible compared to many other places where assisted dying is legal.
Narrower how?
Well, some countries, for example, might include people with chronic, incurable conditions causing terrible suffering, even if they aren't, strictly speaking, terminal in the short term.
I see.
And in a few places, internationally, there's even been discussion around eligibility based purely on severe mental suffering, though that's highly controversial.
Right.
The UK bill is definitely aiming for a more restricted scope, at least at this point.
Okay, let's shift to public reaction. What's the feeling out there? Is there much support for this?
Well, opinion polls pretty consistently show quite a significant level of public support here in the UK,
Yeah.
especially when you mention the safeguards.
Okay.
A recent Ipsos poll, for instance, suggested something like 67% of the public are in favor under those strict conditions.
That's quite high. What's driving that support, do you think?
Often it seems to come down to ideas of personal dignity, autonomy,
Choice.
and compassionate choice, yes. The idea that if someone is facing unbearable suffering from a terminal illness, they should have the right to choose how their life ends.
But of course, it's not universally supported. There's significant opposition, too.
Oh, definitely, yes. The opposition is vocal and comes from various places, ethical, moral, sometimes religious grounds about the inherent value of life.
What are their main worries?
A primary concern is that the bill could, maybe unintentionally, devalue the lives of people seen as vulnerable.
Like who?
Well, the elderly, people with disabilities, maybe those who don't have access to really good palliative care. There's a fear it could create pressure, make them feel like a burden.
Mm-hmm. And then there's that phrase you hear a lot, the slippery slope. What's that about?
Right, the slippery slope argument.
Yeah.
Basically, it's the idea that if you legalize assisted dying for one specific narrow group.
Terminally ill in this case.
Yes. Then there's a risk that over time, the criteria will gradually expand. It might start to include other conditions, other groups of people.
Mhm.
That's a big worry for many opponents, including some doctors.
Is that just a theoretical fear, or has that actually happened somewhere?
Well, people raising this concern often point to places like Canada or Belgium.
Yeah.
In both those countries, the initial laws were focused mainly on terminal illness. But over time, the eligibility has broadened.
How so in Canada, for example?
Canada's law now includes people with chronic, incurable conditions causing intolerable suffering. And there's been a lot of debate and some expansion related to mental illness too, although that's particularly complex.
I see.
So those international examples are often used as sort of evidence that this gradual widening can happen.
So even though the UK bill seems tightly drawn now,
Yes.
the experience elsewhere raises questions about whether those boundaries could shift in the future.
It does raise those questions. Supporters of the UK bill stress the tight controls, the safeguards built in now.
Right.
But opponents argue that holding those lines legally, long-term, can be difficult, especially as society's views on suffering might change. It's a really central point of the whole debate.
Let's dig into the ethics a bit more. Why does this spark such strong feelings on both sides?
You've got this fundamental clash, really, between two deeply important ethical principles.
Okay, what are they?
On one side, you have the principle of the sanctity of life, the idea that life itself has inherent value and shouldn't be intentionally ended. This often comes from religious views or just deeply held philosophical beliefs about the worth of every human life.
Okay, sanctity of life. And the other side?
The other principle is individual autonomy, the right of competent adults to make their own decisions about their own lives,
Including the end of their life.
including how and when they die, yes, especially if they're facing suffering they find unbearable with no hope of getting better. It's about self-determination, charting your own course.
That really is a profound conflict. How does this play out among doctors and nurses within the medical community?
Well, the medical community itself is quite divided. You have some doctors who see offering assisted dying as potentially an act of compassion.
Compassion.
Yes, providing relief for patients in terrible, intractable suffering, letting them have a more controlled, perhaps more dignified end on their own terms. They see it as part of patient-centered care.
But not everyone agrees.
Not at all. Many other healthcare professionals feel very differently. They believe assisted dying goes against the fundamental role of a doctor, which they see as preserving life. Easing suffering, yes, but not intentionally causing death.
The Hippocratic Oath, do no harm.
They often mention the Hippocratic Oath, yes, and that core ethical duty. And beyond that, there's the issue of moral distress.
What's that?
It's the significant distress clinicians might feel if they're asked to participate in something that goes against their personal or professional conscience. That's a major factor for many in the field.
We touched on international comparisons. You mentioned Canada and Belgium. How about places like the Netherlands or parts of the U.S.? What can the U.K. maybe learn?
Right. Well, the Netherlands has had euthanasia laws for, over 2 decades now.
Wow.
Their initial criteria were quite similar to the UK proposal, terminal illness, unbearable suffering, but it has evolved gradually to include some cases of unbearable suffering from non-terminal conditions, though under very strict assessment.
And Canada's evolution, as you said, really fuels that slippery slope concern.
Yes, Canada's experience is definitely one that gets brought up a lot. Started with terminal illness, then legal challenges led to including chronic conditions causing severe suffering. And then, more recently, that really controversial discussion about extending it to mental illness as the primary condition, though. As I said, that part's currently paused.
Okay.
So that evolution is what people worried about the slippery slope often point to.
So looking at the UK bill, does it seem like the drafters have tried to sort of learn from these other experiences, put in specific safeguards?
It does look that way, yes. The current structure, focusing strictly on terminal illness for now, and especially that multidisciplinary panel.
Right, the panel.
That panel seems like a unique feature, an attempt to provide a more comprehensive expert review than just, say, 2 doctors or even a judge alone might offer.
So trying to keep the scope tighter than perhaps it's become elsewhere.
The emphasis certainly seems to be on maintaining a more narrowly defined scope compared to where some other jurisdictions are now, yes.
Okay, let's imagine the bill does pass here. What changes might we actually see in the NHS and the healthcare system?
Well, there'd likely be quite a few significant impacts. For one, healthcare professionals would need very specific training
Training on what?
on how to handle requests, how to assess mental capacity properly, how to determine eligibility under the law, and the practical side, prescribing, administering the medication.
That's a huge shift for doctors and nurses.
It is. It would mean developing clear guidelines, protocols within hospitals and clinics to make sure everything is done consistently and legally.
Okay.
And probably we'd see an even bigger focus on end-of-life conversations generally.
You mean like advanced directives, things like that?
Exactly. More talk about advanced directives, making sure everyone who needs good palliative care can actually get it, and fostering really open conversations between patients and doctors about all the options towards the end of life.
And stepping back even further, what about the wider societal impact? Just this whole debate must be having an effect, right?
Absolutely.
Yeah.
The debate itself is already making us talk more about aging, about dignity, autonomy, how we care for vulnerable people.
Mm-hmm.
If the bill passes, it might lead to, perhaps, more normalization of discussions about death and dying, maybe a greater acceptance of individual choice at the end of life.
And if it doesn't pass, if the bill gets rejected?
Well, the issue isn't going to just vanish. It'll almost certainly remain a big legal and ethical sticking point.
Yeah.
And we might well see future attempts, maybe revised proposals with different frameworks, different eligibility ideas as, society's views continue to shift.
Well, this has been incredibly illuminating. Thank you so much for walking us through such a complex and, frankly, deeply personal topic with such clarity.
It's been good to talk it through. It's important.
And thank you, our listener, for joining us for this deep dive into the assisted dying bill here on the Westferry Times.
Yes, thank you for listening.
We really hope this has helped clarify the key parts of the bill and the different arguments swirling around it. If you found it insightful, please do subscribe to the Westferry Times. Maybe share it with others who might find it valuable.
Keeping the conversation going on these tough issues is crucial.
It really is. And as we wrap up, maybe something to think about is that tension we discussed. How do we, as a society, balance our shared value for preserving life with respecting an individual's right to make profound choices when facing the end? Or perhaps it just prompts you to think about how you might prepare for and communicate your own end-of-life wishes, whatever the law happens to be. Something to ponder. Thanks so much for listening.
Bye.